This week on Sound Health. $12.9 million infants die of vaccine-preventable diseases. 1 in 10 infants worldwide did not receive any vaccination in 2016. Sadly, it is one of the top 10 causes of death in those less than 5 years old. In Nigeria, the case is not different, as the Global Alliance for Vaccine and Immunization says no fewer than 800,000 unvaccinated children had died in Nigeria in the last 5 years. Only 1 in 4 children in Nigeria receive all recommended vaccines. The more reason key advocates intensified campaigns for routine immunization. This has reduced pockets of diseases globally. Despite this success, more than 3 million people die from vaccine-preventable diseases. Vaccination is the administration of a biological preparation that provides active acquired immunity to a particular disease. A vaccine typically contains an agent that resembles a disease-causing microorganism and is often made from weakened or killed forms of the microbe. Its toxins are one of its surface proteins. In 1976, Edward Jenner was the founder of vaccinology in the West after he inoculated a 13-year-old boy with vaccinia virus and demonstrated immunity to smallpox. In 1798, the first smallpox vaccine was developed. Immunization shots are essential. They protect against diseases like measles, mumps, hepatitis B, polio, tetanus, and whooping cough. Immunizations are important for adults as well as children.
There's been a lot that has been achieved in the area of routine immunization, and we know that this is one of the most successful and cost-effective public health interventions ever. We also know that the returns on investment are huge. For every child immunized, there's actually a $16 return on investment, or in terms of money saved. So this is one of the most effective tools that we have available to us in public health. And the fact that today we have so many new vaccines that can prevent some of the deadliest diseases, which 10 years ago or 15 years ago we didn't have.
The NIPD's campaign was introduced in Nigeria since 2016 as one of the strategies for improving immunization activities and reducing the number of unimmunized children in the country. Like other states, Yoruba State participates in all catch-up immunization campaigns geared towards increasing immunization coverage in Nigeria.
The truth is, no child needs to suffer from chickenpox or any other vaccine-preventable disease. Childhood vaccines are available for free. With all the benefits, why are there cases of vaccinated-related diseases in the country?
We had a 9-year success story where we've not had any case of wild polio virus in Lagos State. Unfortunately, because Lagos State is part of Nigeria, Nigeria still remains one of the 3 endemic countries for polio. We're the only ones remaining in Africa. So we're trying to combat this. That's why we participate in all these kind of immunization campaigns.
World Immunization Week aims to highlight the collective action needed to ensure that every person is protected from vaccine-preventable diseases. This year's theme, Protected Together, Vaccine Works encourages people at every level, from donors to the general public, to go further in their efforts to increase immunization coverage for the greater good.
Our focus is on routine immunization. So even before they start the immunization campaign, if any parent takes his or her child to the hospital, they should be given the vaccine because the vaccine is available there. That's part of the routine immunization. Where they are doing this campaign is that there are a lot of people mix children and meals and that kind of thing. That's why to catch them and make all the noise possible. And part of that is to enlighten the public on the need for immunizing our children. But the goal is that this thing should be routine. You know, you have a child, you should know that at a particular age, that child is due for this immunization. You take this child to the health center.
The important thing is that if you look at it from the perspective of the caregiver and the child or the infant, you know, the caregiver or their family or the mother needs to be able to know where to get services, when those services are going to be available, and every time she has a newborn, she should have that information, and she should be treated with dignity and well received and provided this immunization services that is required. Again, we take that for granted, but in many places in the world that is not the case. So these are really important so that we are having strong immunization systems that can deliver immunization services everywhere, every time, and to everyone.
Lagos State government has deployed over 7,283 teams to even go house to house. We have over 4,859 teams that will go knocking on the doors to do this. We would also visit marketplaces, schools, religious bodies, churches, mosques, parks. Everywhere we find these eligible children, we will ensure that we have to immunize them.
Government at all levels, community-based organizations, and other stakeholders are working hand in hand to accelerate and strengthen routine immunization to ensure immunization coverage of children in the first year of life. Unfortunately, some parents opt out simply because of myths about vaccine safety concerns. Scientifically, it has been proven that vaccines are safe health-wise
through a simple act of vaccination. This vaccination is free, it is free of complications, it is given freely, and it saves lives. That's why we have the slogan, one shot, one life. You give one shot, you save one life.
It's really helping because this is my third child, and the other two have been taking it for their, I can see it's really seriously helping.
And we encourage the other parents, the mothers, that should bring out their children, that should come and take the immunization, so that our children, they will be a good person in the future, they will not become any handicap.
Insecurity in complex settings is also a major challenge in immunization coverage. The greatest challenge faced by vaccinators are non-access to gated communities, especially in highbrow areas.
We have always suspected that there are children trapped within the insecure areas that we have not been able to reach, and the commendable efforts of the federal government in getting the troops to liberate those areas has led to an upsurge in the number of children we can reach, because a lot of them are now coming to IDP camps situated either within the municipality or surrounding areas or around Chibok. So we're able to reach much more children now than we're able to reach before.
Part of the global focus right now is to ensure that every child, no matter where they live, that they're immunized and that they have access to these vaccines, and that we are closing the equity gap so that we're ensuring that it doesn't matter whether you're rich or you're poor or which country you live, that you have access to those life-saving vaccines. So, there's a real collaborative effort amongst a number of partners to ensure that immunization programs are strong and that they're delivering on a regular basis routine immunization services to ensure there's high coverage and that we're closing equity gaps.
So you're seeing somebody who has survived polio. And so it's very important that we continue to educate people and create the awareness on how to completely kick polio out forever. Because polio is a dreaded disease, and like I always say, he who feels it knows it. So I'm in my 40s, and that's to say that for about 30-something years of my life, I've had to use all kinds of walking aids, I've had to go through all kinds of challenges, but I still stand very tall in this one. But the truth is, prevention is better than cure.
Every shot counts. Vaccination protects children from diseases. Ensure your child is immunized at birth, 6 weeks, 10 weeks, 14 weeks, and at 9 months. Secure their future health-wise. It is your responsibility. you.